Our medical contributor now, Dr. David Agus, joins us with ideas to keep you and your Thanksgiving gathering safe. Dr. Agus, good morning. Happy Thanksgiving to you. As we mentioned yesterday, the deadliest day of the pandemic was yesterday, the deadliest day in more than 6 months. So the question is, there is a lot of second guessing going on about how to stay safe. What's the best course of action?
Well, obviously, 2,100 deaths each of the last 2 days, cases going up, so we all have to be careful. If we're getting together with people, and a lot of people are, the following you need to pay attention to. One is each pod, that is who you live with as a pod, needs to have separate tables and be separated. Have one place where there's food and go, and have wipes so you can actually have different utensils or wipe the utensils, so each family is going to eat different. Focus the meal in short periods. So you're eating the meal, and then the rest of the time where you're talking and socializing, your social distance and wearing a mask is critical. We just saw that national weather map. The good news is most of the country can have their Thanksgiving outdoors or with the windows open. Better ventilation, doing it outdoors will dramatically reduce the risk of spread of the virus. There's no question that getting together increases risk. The hope is you could do some of these things to lessen the risk.
I know we've seen a lot of long lines for testing ahead of the holiday. Does testing ensure safety?
Well, no. I mean, obviously, you asked the leading question, and the answer clearly is no. It is not a free pass. So many people are being tested now, first of all, because case numbers are through the roof and people were been exposed, but also they wanted to get there with a grandma or get together with their family during the holiday, and they got a test. That test is not a free pass to keep the mask off. It's not a free pass to not social distance. Testing is great, identifying people and then quarantining them or contact tracing, critical, but wear a mask and social distance, please, even if you tested negative over the last couple days.
I want to switch gears now to some vaccine news. AstraZeneca is facing some new questions about its vaccine's efficacy after admitting a key mistake in the dosage given to some trial participants. How significant is this?
Well, early in the trial, it showed you the complexity in manufacturing. It was calculated the wrong dose in the vial. So the first several thousand patients received a half a dose instead of a full dose. And the second dose of the vaccine, they got a full dose. Well, it turns out in those individuals, they had a better response than people who got full dose and full dose. And so there are a lot of reasons why we think it's because that the vector, what is around the spike, you make an immune response to, and a lesser dose dose, and that enables you to make a better immune response to that spike protein. Still, remarkably important vaccine, remarkably important trial.
Yeah, that's just one vaccine from one supplier, but we're looking for others. Dr. David Agus, thank you.